Thank you, guys. Appreciate it. All right, roughly 600,000 Americans each year will develop potentially life-threatening blood clots, and about 100,000 of them will die from complications. As we learn in this report, prevention is the key weapon in the fight against this silent killer.
Pregnancy and obesity are two of the common culprits that cause blood clots to develop in places they're not supposed to. Taking birth control pills or hormone replacement therapy also puts you at a higher risk. These are factors you have some control over. Things you have less control over include getting older or having major surgery that requires bed rest.
Sometimes a blood clot can occur spontaneously or in association with certain risk factors in a major vein in the body, usually in the legs, and we call that deep vein thrombosis, or DVT for short. And sometimes that blood clot can break off or break apart, and a piece of it can travel up through the veins to the lungs and cause what we call a pulmonary embolism, or PE for short. It's this latter condition that is really most serious, life-threatening, and sometimes can be fatal.
So what do? For starters, lose weight, get more exercise, and if you have the option, stop taking hormones or birth control pills. But if you do develop DVT, the good news is new treatments are hitting the market that can help.
Now, for the first time, there are new oral blood thinners or anticoagulants that are available. And one that was just recently approved by the FDA for the treatment of DVT or PE is a blood thinner called Xarelto. This is really much easier to use. It does not require monitoring. It's been shown in clinical trials to be as effective and as safe, if not more so, than Coumadin. And I think it really changes the way we'll treat patients. In fact, it also rarely would require hospitalization, which is necessary today with the standard therapy. So it has a lot of advantages to improve the outcome of patients with DVT or PE.
Once you've developed a DVT or PE, you have up to a 30% chance of it happening again within 5 years after treatment. That's why prevention is key. To learn more about this condition, visit stoptheclot.org.